Hi, I'm Suryo Gardner. I have a master's in clinical psychology, and I'm a certified BodyTalk practitioner and instructor. This bacteria is something where they have, again, boundary issues, and also from what my experience is they're fear-based. They have a lot of fear in their system. And so from my perspective, I'm going to have to deal with that fear initially. That's an important piece. And also they're going to look at diet. They're going to look at also their sexual partners, like are they in good relationship with their sexual partner, or is it somebody that they have a lot of conflict with? I would deal with relationship conflict probably first, because that's the most obvious. You start at the top and then work your way down. And to have them look at, is this person somebody that they really are in a trusting, open relationship with? Do they have good communication? Do they have a good sexual life? Or is it filled with a lot of fear and shame and guilt? And shame and guilt come into play as well. And then I would go into the psychological aspect of their own fear, their own shame, their own guilt, and how that is incorporated in this situation. And we do a lot of emotional release work, so we're taking the charge off. And then you have to dig deeper into belief systems, because anyone coming up with this will typically have a lot of self-loathing belief systems. And so when you clear those, the person can feel more empowered, they can feel happy about themselves, and then they can have a new way of relating in their relationship, their sexual relationship. A bacterial infection can clear very quickly. The infection can clear up very quickly with BodyTalk, because we have techniques specifically that are non-invasive to clear the system, to rebalance it actually. The psychological work can take a little bit longer, because that has to go deep into the body. Again, it can go into the fascia, it goes into the cellular memory, it goes into the brain, it goes through generations. So it can clear, but I would say it would take several sessions to do that. But it's absolutely workable. I would suggest getting a BodyTalk session as soon as they can to deal with the infection, and then to start looking at their life, like what is their relationship, and so writing about that, beginning to open communication with their partner, and coming in, of course, for sessions, for BodyTalk sessions. Hi, I'm Suryo Gardner. I'm a master's in clinical psychology, and I'm a certified BodyTalk practitioner and instructor. Yeast infections, specifically, I've worked more with women, but men can also have that yeast situation as well. But with women, yeast is a lot about sugar craving. It's a lot about not feeling happy in their lives, about being imbalanced biochemically. And it's also, at the psychological level, it's feeling like they have no sweetness in their life. Yeast infections, from my perspective, from what I've seen in my clinical practice, is the woman will have possibly poor boundary issues. She'll be craving sugar, which means that she probably isn't doing what she wants to do in her life. Her life is out of balance. She's not doing self-care. She's probably got low self-esteem, and she really needs to work on building up her own psychology. She really needs to learn some self-love, to put it simply. Treatment for yeast is, first we would want to deal with the yeast at the biochemical level, so that balance can happen right away. And that will help her immediately to balance that out so she can get some relief. And then the psychological issues, again, she's going to have to work within herself in BodyTalk to balance out some of the old beliefs, a lot of limiting beliefs in yeast infections. Limiting beliefs of, I'm not good enough, I'm not competent enough, I'll never get what I want, I'll never be loved, I'll never be supported. That kind of limiting belief, those beliefs have to be worked with at all levels of the body, not just at the psychological talking level, but at the connective tissue. The fascia holds those beliefs The cellular memory holds those beliefs. So working with it at all levels of the body mind. And when those beliefs are balanced and she begins to develop a new attitude about herself, it can really clear up, and so that she doesn't have to get it again in the future. What a woman can do right now, one thing that I like to have them do is to write down what happens around sugar cravings, what happens around sleep patterns, like what time that's happening, and also what they're saying, the inner language inside their head, what they're saying to themselves about who they are, to begin to become aware of some of those patterns, to write those down, to schedule a BodyTalk session, and to also look at the cortices video, which is on my website.